Hello, everyone. My name is Mustafa Suni. I'm the Program Director for Neglected Tropical Disease in Helen Keller in Sierra Leone. The Ministry of Health and Sanitation, in collaboration with our partners, is celebrating this year's World NTD Day. The theme for this year's celebration is "We celebrate hard-earned progress and take actions to end neglect and beat NTDs." Despite the global challenge today we have all over the world, including the COVID-19, we think this day should not pass without us celebrating the success we have achieved in this country. So we have outlined a series of activities that we started doing already and will continue to do the next couple of days in collaboration with our partners. This includes and not limited to having adverts on widely read newspapers in the country. We have been able to articulate the success we have made. The Ministry of Health and Sanitation in collaboration with partners have made press release, radio discussion program on most popular programs in this country. So what you'll be coming to see will also be presentations of lymphatic filariasis, what we call locally here Bigfoot, onchocerciasis, we call onco or river blindness, schistosomiasis, we call local mansonine, and soil transmitted hernia, we call belly worms. Thank you very much, and I wish you a happy listening.
Good day, everyone. I am Abdul Conte, the Monitoring and Evaluation Officer for Neglected Tropical Disease, Ministry of Health and Sanitation. I'm presenting on the elimination of onchocerciasis in Sierra Leone. When the black fly bites an infected person, it becomes infected with baby worms. When this same black fly bites another person, the person becomes infected, and these baby worms in that infected person develop into adult worm, and this adult worm form lumps into the body of that newly infected person. These lumps we call nodules. This adult worm produce millions of baby worms on daily basis. The picture is showing how the transmission from one person to another person occurs, and the vector black fly who does the transmission. As a result of the baby worms produced by the adult worm, they cause a lot of itching on the individuals, and this itching can result to dermatitis, lizard skins, leopard skin, and depression as a result of the itching. As you can see from the picture, this is a typical presentation of the pigmentation of the skin, which we call leopard skin. If this person remain untreated for several years, the baby worms will damage the eyes of that individual and result to gradual loss of vision and permanent irreversible blindness. Prior to the Mass Drug Administration, 1999 to 2004, there was no mass drug administration. There were high prevalence in fishing community along rivers in the whole country. There were all the 12 districts are endemic with onchocerciasis, with the exception of Burnt Island, Western Rural, and Urban. Baseline assessment was conducted in 2002 and 2004 using skin snip by trained Sierra Leonean technicians. They take the skin snip, process it, and examine it. It shows high amount of prevalence among communities, especially Bombali district and Pujan district, where all persons that were tested are show above 65% infection. Mass drug administration started in 2005. About 2.8 million were targeted with mass drug administration of ivermectin annually. And who does this work? We are the community drug distributor. They are selected by community members and given to the health worker who train them on the mass drug administration. As you can see from the right picture, is showing a typical height board that is used, which is calibrated and approved by WHO. In the early days of mass drug administration, when we started the program, after 1 or 2 years of mass drug, people were showing high side effects, swelling, itching, high temperature. But after 3 days of mass drug administration, the itching subsides and people feel sign of relief, considerable relief after the MDA. After 5 or 6 consecutive annual mass drug administration by the program, there were few worms in amongst people, among persons. So there were few worms to be destroyed by the drugs. So there were less side effects among community members. To show that the program has done significant impact in the country, the eye care services has shown seen no case as a result of onchocerciasis since 2012. Before the program moved from control to elimination, WHO advised the country to set up a committee which we call a technical advisory committee that meets twice per year to advise the program towards the portfolio of elimination. By the grace of God, in 2025, we'll get there. In 2019, the program also did an assessment of onchocerciasis pre-stop MDA, which took place in 2019. And then villages among rivers were tested, and there was less prevalent that show, and the result will show in 2021. I quote from the focal person of Bond District that fishermen are no longer ashamed of wearing trousers. Reason being because there's no more pigmentation, leopard skin, lizard skin among community members. This is a picture showing the district health management team, the NTD program staff, and partners coming together to plan, showcase their implementation for that year, and then challenges, recommendations, and lesson plans. Thank you.
Good day, everyone. I am Abdul Conte, the Monitoring and Evaluation Officer for Neglected Tropical Disease, Ministry of Health and Sanitation. I'm presenting the progress the NTD has done towards elimination of lymphatic filariasis, normally called Bigfoot in Sierra Leone. Bigfoot or bosin in men is transmitted by mosquito from one person to the other. In the early days of infection, there is no signs of infection. After 10 or 20 years, then it starts to manifest signs and symptoms. Mostly, it starts slowly and begin to progress. Slowly. Common area of target for the Bigfoot is 1, the scrotum, 2, the feet, and sometimes the breast and the arm. Sometimes when it starts to appear, you see signs like thick and cloudy urine. With a long-term infection, then the swelling starts suddenly with high pain and fever, which normally occurs at night. The picture in my right-hand side shows the life cycle of lymphatic filariasis, we commonly call Bigfoot. In 2005, prior to the mass drug administration, there was justification from the assessment conducted by the program that there is a need in all the 14 districts for mass drug administration of ivermectin and albendazole combined. And we are targeting all above 5 years. We succeeded in getting funds from USAID. So we started in the 6 border districts for the mass drug administration in 2008. And then we rolled over in 2010 into the whole 14 districts, covering above 65% treatment coverage and 100% geographic coverage. The exclusion from 1, pregnant women, 2, very elderly and sick people were not given the drugs, but all eligible persons above 5 years were treated with ivermectin and albendazole combined. Bosin developed in many years of infection. Prior to the mass drug administration, we conducted an assessment taking midnight blood sample because the parasites appear in the circulation at night. That's why and the program has trained technicians that collect the blood, stain them, and examine them. It shows that Bombali and Kwenadugu that are bordering with Guinea have high prevalence of the disease because the baseline of the neighboring country was very, very high. The mass drug administration started from 2008 to 2013, and we treated 5.2 million persons year in, year out with ivermectin and albendazole. And the persons that distribute the drug among community members are community drug distributors. These community drug distributors were selected by community themselves and given to the health worker. And this community drug distributor distribute the drug among community. As you can see from the picture, this is a typical representation of mass drug administration in dense community like towns and urban settings. And the dose poll is given to us by WHO guidelines. Assessment of progress towards elimination. After 5 years of mass drug administration with effective rounds of treatment coverage and geographic coverage, we did an assessment, collecting blood sample from targeted sentinel sites, and there is no transmission in 8 districts, which show to us that we have succeeded in stopping transmission in 8 districts, and we are only remaining with 4 districts: Bombali, Kwenadugu, Kailam, and Kenima. These districts are known to be bordering with Guinea and Liberia. And these districts, we call them hotspot districts. After the Ebola in 2015, we continue our mass drug administration in these hotspot districts, the likes of Kailam, Kenima, Kwenadugu, and Bombali. We did another assessment for the transmission of LF in community members, and these districts failed again. There are still active transmission shown from the 2017 assessment that we did. So with serious mass drug administration for another 2 years, we conducted another assessment in 2020, and we succeeded in stopping transmission in 2 hotspot districts, that is Kailam and Kenima. And we are now remaining with another 2. But because of the de-amalgamation, Bombali has de-amalgamated to Bombali and Karina, and Kwenadugu to Kwenadugu and Falaba. But now, as I'm talking here now today, that 5.8 million Sierra Leoneans are no longer at risk of the infection, developing Bigfoot or Bosi. Progress towards elimination. The mass drug administration of ivermectin and albendazole above 5 years continue in Bombali, Karina, Kwenadugu, and Falaba, as I earlier said. In 2022, hopefully we'll get there and get rid of lymphatic filariasis in our country, including the 2 hotspot districts. Then surveillance will continue in targeting 8 million people in Sierra Leone that are now no longer at risk of developing Bigfoot or Bosi. This is a picture showing the district health management team, the program, and partners coming together, presenting in an annual review meeting in the district. I thank you very much.
Hello, my name is Sister Sama Conte, National Supervisor of the NTD program, Sierra Leone. I'm here presenting on the progress towards the control of Mansonine or schistosomiasis in Sierra Leone. Schistosomiasis is transmitted via small snails in stool or urine contaminated fresh water. Blood loss occurs in both stools and urine and can lead to anemia, which is detrimental to their health. In children, it impacts their school attendance, learning, and contributes to poor school performance and wage earning capacity in later life. It may also lead to school absenteeism, higher dropout rates. If untreated, it causes liver and kidney diseases, infertility in later life, and reduced life expectancy. In 2008 and 9, a baseline study showed high infection rates in school-age children, over 50% in Koinadugu, Kono, and Kailahun, justifying annual mass drug administration with praziquantel or Pontel. Some chiefdom in Kenema, Bo, Bombali, and Tonkolili had level between 10 to 50%, justifying mass drug administration with praziquantel every 2 years. The coastal district has shown levels of infection. Mass drug administration began in 2009, targeting over 500,000 school-going children in 6 districts. From 2010 to 2017, around 2.2 million school-age children and at-risk adults have been reached annually with praziquantel. Health workers use a dose poll to judge number of tablets to determine. Health workers use the dose poll to determine the number of tablets ranging from 1 to 5 based upon height. Since 2019, mass drug administration has focused on school-age children, treating over 500,000 annually. In 2016, after Ebola, an assessment showed that control has been reached in 4 districts, Bo, Bombali, Kono, and Tonkolili, less than 10% of school-age children infected. 3 districts, Koinadugu, Kailahun, and Kenema remain over 10%, but considerably less than the over 50% Act baseline. National goal for control. Less than 10% of school-age children infected and less than 5% with moderate or heavy infection. By 2025, a partner network forum has been created with WASH and education partners to sensitize and strengthen the Environmental Health Directorate to implement rural water supply and sanitation program in high-risk communities. The assessment is scheduled for 2022. Thanks for listening.
Hello, I'm Sister Ekundayo Karim, National Supervisor for the Neglected Tropical Disease Program, Ministry of Health and Sanitation, Sierra Leone. Celebrating World NTD Day, I'm presenting on the topic Progress Towards the Control of Soil-Transmitted Helminths, Signs and Symptoms of Intestinal Worm. I want to start with a picture. This is the life cycle where open defecation and poor hand hygiene leads to contaminated food and water. And when one's children are infested, they experience poor growth, stunting, that is reduced height, reduced school attendance. They don't go to school because they're always sick. Weak school performance because they are always sleeping. They lack concentration. They are always anemic. They lose appetite and they lose weight. Intestinal worms in pregnant women cause low birth weight and poor health. Studies for intestinal worms in the 1990s in Sierra Leone. This one is very common in children and adults. Although some studies in school-age children shows that 90% were infested, many were heavily infested, above 90%. Most had multiple infections, that's more than one species. Hookworm is very common and has the highest rate in Africa. Why? Because we live in a warm, moist temperature, and sanitation is very, very poor. We have other common intestinal worms, roundworm, threadworm, pinworm, whipworm. But in 2010, a campaign was done where several testimonies of people passing out worms when defecating. 4 strategies to control intestinal worm. For me, I can say 4 successes, because from 2002 to 2011, we dewormed and targeted over 500,000 school-age children, supported by numerous INGOs, NNGOs, and UN agency in vulnerable settings. From 2006 to 2020, we have done 2 rounds of mass treatment, targeted over 1 million preschool children during the Mami and Pikin Well Body Week in Sierra Leone. From 2006, we did routine deworming, which started targeting approximately 200,000 pregnant women during hospital visits when they do go for antenatal in the hospitals. From 2005, we did mass drug administration against liver blindness, targeting everyone from 5 years and above with ivermectin. And from 2008, albendazole was added against Bigfoot and reached up to 5.2 million people in Sierra Leone. And we did that one annually. In addition also, we do health promotion and BCC, where radio program is continuous, environmental health also, and a partner network forum has been created, WASH, water, sanitation and hygiene. Baseline studies in 2008. As you can see the map on your right, the map shows the prevalence rate in the country. A national survey of stool sample from children aged 9 to 14 was done. Infection rates were moderate, 20 to 49%, or high, over 50% in most areas. And multiple infection has gone down drastically. Why? Due to the intervention that has started from 2002 onwards. Assessing progress in 2016. After Ebola, another assessment to review treatment guidelines shows that control has been reached in 8 districts, less than 20% prevalence. And in 6 districts, that is Tonkololi, Bombali, Koinadu, Bons, Moyamba, and Kujen, remains with over 20% above rates in school-age children, which match the lower rates of improved sanitation in household and primary schools. The picture showing the hand washing facility that has been introduced in school during Ebola. Reassessment schedule for 2020. Annual MD with albendazole will continue in school-age children during mass drug administration for river blindness in 10 districts. And for Bigfoot, it will be only 4 districts until 2025, where we'll be targeting, we'll finish targeting 1.9 million. And twice annual albendazole is now offered with vitamin A supplementation and routine counseling for caregivers on family planning and nutrition as an integrated reproductive and child health service at health facilities, all the facilities in Sierra Leone. The picture on your right showing you the warm-up quiz at the annual NTD review meeting 2020. Post-Bigfoot MDA strategies to maintain control. We have integrated WOWOM into routine health service for preschool-age children. We have expanded routine health service to include school-age children also at all facilities. We have incorporated WASH consortium to support the Environmental Health Directorate to ensure clean water supply and sanitation facilities. The picture on my right will show you the school health focal point presenting Moyamba district data at the annual review meeting. See how they are smiling on this picture because there is progress towards the control of soil transmitted ailments. I thank you.
Hello, my name is Roland Conte, National NTD Focal Person Surveillance. I'm here to present progress towards Bigfoot, hydrocele, and Bosine management. From the heading, you see the topic itself. Country cannot be satisfied without having to manage their Bigfoot and boson control measures and management measures in the country, as shown in the picture. The slide next shows the benefit of lymphatic filariasis elimination. Far-reaching the benefit across the country, you realize that the benefit of LF elimination depicts that health workforce enables trillions of Sierra Leoneans in annual to attain their annual earning revenue. And at the same time, it lowers burden on primary health care. So automatically, all those expenditures and other forces that would have been applied on primary health care would have been diverted into other aspects other than focusing on the lymphatic filariasis elimination. It also reduces the conflict due to greater economic opportunities, in the sense wherein economic activities and opportunities are available and they are geared towards attaining that, it automatically reduces all those conflicts that would have been created in order to divert those economic opportunities in ensuring that LF is eliminated. It improves livelihood in the least developed areas in the country. Of course, persons that are actually have cured from LF, they will be able to improve their livelihood in the case where they are being affected or burdened with the disease. So automatically, persons that have actually healed from the LF disease would have actually increased their livelihood in all aspects. The economic burden of LF in Konadugu district as a case study. This was a survey done in order to show the impact of Sierra Leone's economy by trillions of Sierra Leones every year as a result of the debilitating effect of LF. In fact, one of the highest rates of the infection that can lead to hydrocele and lymphedema automatically limits the productivity by an estimated 65%. Looking at the trend, with an annual estimate earning of approximately Sierra Leoneans of 10 million, which would have attained, but as a result of the estimated 1,868 people affected with hydrocele and 1,444 people with lymphedema, with this number, it automatically would have not been able to utilize the estimated earnings for the 10 million in the country. So this is a serious problem that will lead to loss in income up to 12.1 trillion annually if untreated due to reduced worker productivity. As many colleagues have presented, you actually see in the management of hydrocele, the boson, you actually see that a need of 10,000 individuals with hydrocele with advanced LF hydrocele would have required surgery. But as a result of this situation, 10% would be the issue targeted, with about 90% being the gap. This shows automatically that with the 10%, we have NGO, the end fund, which due to proposals being presented, have agreed to support 1,000 surgeries to reduce the burden of disability of hydrocele in the country. And another NGO, Kappa Care, which have trained over the years 34 licensed surgical assistant community health officers and 14 medical superintendents, with which can enable to provide WHO approved hydrocele procedures. So you actually see with 34 licensed surgical assistants and 14 giving a total of 48. So with all this achievement, you actually see that we still have got a gap, and this gap requires us to meet some of the challenges that we will be able to achieve over time. So I want to thank you all for listening. Hello, my name is Roland Conte, National NTD Surveillance Focal Person, presenting under cross-sector coordination to implement long-term, cost-effective programs as part of elimination. The stakeholder landscape and barrier analysis for NTDs. In this aspect, the analysis identifies stakeholders and coordination platform at national and district levels, as seen from the picture. The results to be used to leverage existing distribution platforms and in-country technical expertise as to implementing long-term, cost-effective control programs. The results validation meeting of the landscape and barrier analysis shows that this meeting validated findings from the landscape and barrier analysis collected from key stakeholders. Stakeholders include government ministries, UN agencies, technical advice committee, and NGO partners. Stakeholders outside the Ministry of Health and Sanitation, MOHS, were engaged to support priorities for sustainable NTD programming, leveraging across sector coordination. Existing caps and barriers for cross-sector coordination were discussed, and opportunities and solutions to address them were also raised. As part of the cross-sector coordination as roadmap to development, key areas were mentioned to identify priorities, terms of reference developed for the Partners Network Forum with input from partners and stakeholders. Then mechanisms of interfacing with private sectors. And lastly, increase NTD visibility and strengthen cross-sector collaboration for NTDs. I want to thank you all for listening.